Good afternoon. This is Township Manager Dean Kazinci. We are facing a global health crisis unlike any before, one that is spreading human suffering, infecting the global economy, and upending people's lives. We are asking people to come together as a nation by staying apart from each other. As difficult as that sounds, it must be done. As a community, we are anxious, we are tired, and we are fatigued. We are dealing with a war we've never dealt with before. The coronavirus is an enemy we all agree we want to defeat. We must do everything in our power to stay ahead of this virus. Make no mistake, we will defeat the enemy if everyone remains vigilant, even if it means remaining isolated for long periods of time. This human crisis calls for a solidarity, and there is no other community that can do it better than Teaneck. Today, I want to provide an update on the steps the Township has taken locally to protect the health, safety, and well-being of our residents, workforce, families, and friends during the COVID-19 public health crisis. I also want to reiterate what this crisis demands on each and every one of us, individually and together, as we move forward to keep our residents and workforce safe. We are not powerless, and we are not alone. All of our lives have been impacted by the COVID-19 health crisis. This unprecedented situation has caused national, statewide, county, and local disruption to how we go about conducting our everyday lives. I do not say this to frighten or alarm the community. However, it is important for everyone to know the current COVID-19 statistics and how this is impacting our community. I can't say it enough, the importance of self-quarantine, social distancing, and the practice of good hygiene is critical to fighting and surviving this war against COVID-19. As of April 2nd, Teaneck has 413 residents who are presumptive positive for the COVID-19 virus. With a heavy heart, I have to announce that 17 residents have succumbed to the coronavirus. The deaths range from 30 years of age to 92 years of age. Please keep all the deceased and their families in your thoughts and prayers. May God continue to rest their souls. I would like to take a moment to describe how the Township's Health Department works with the state to track, investigate, and manage COVID-19 cases within our community. The state of New Jersey maintains a database of all testing, and that information is shared with local health departments. In the case of a Teaneck resident receiving a presumptive positive test result, our health department tracks, investigates, manages, and further educates the patient on self-care and self-isolation in accordance with New Jersey State Health Department guidelines. An emphasis is placed on the higher risk groups such as healthcare providers and practitioners, healthcare facilities, congregate settings, and non-family clusters. The presumptive positive patient or his or her proxy is asked questions to determine the date of onset, meaning when the onset of symptoms started, and all activities 3 days prior to the onset of symptoms. The communicable disease health officer identifies who the presumptive positive patient had contact with at home, in the workplace, the healthcare setting, or any other locations in accordance with the New Jersey State Department of Health guidelines. The focus of the Health Department is to interview and educate during the contact tracing process. Education is critical as it advises the patient and anyone who may have had direct contact with the presumptive positive patient on how to care for himself or herself during self-isolation. The Health Department investigates each case one by one, and based on various criteria provided during the interview, the communicable disease health officer will make the necessary contacts and notifications under the recommendations put forth by the New Jersey Department of Health. I'd like to thank our health officer, Ken Catter, and his entire staff for their commitment and dedication to our community during this health crisis. Mr. Catter wanted me to remind everyone of the importance of social distancing, especially during the upcoming religious holidays. Regardless of whether you have contracted the virus or if you or a family member is sick or not feeling well, follow all the guidance provided and voluntarily self-isolate, monitor your symptoms, and contact your doctor for professional guidance and treatment. The three main symptoms of COVID-19 are fever, coughing, and shortness of breath. This virus is highly contagious. In many cases, a person can be afflicted with the disease and be asymptomatic and show only mild symptoms. It can spread quickly and unknowingly. Many will recover from the virus, but our older population and those with existing health conditions are highly susceptible to the disease and highly vulnerable. The virus can lead to additional complications such as respiratory issues, including pneumonia. COVID-19 remains a serious public health issue, and everyone needs to take this seriously and work together to eradicate it from our community. It is critical that we all do our part for the public good to help prevent the spread of COVID-19. Hand washing is the best way to keep the virus away. Hand sanitizer with 60% alcohol is also effective if you're unable to wash your hands. Hand washing and hand sanitizing should be done frequently and vigorously. Clean and disinfect all surfaces. Always cover your mouth when you cough and sneeze into a tissue or your elbow. Do not touch your eyes, nose, and mouth. Continue social distancing. It is so important. In the past week, residents have been witnessing others ignoring the closed signs and moving barriers to access playgrounds and athletic fields. They remain closed and for good reason. Keeping your distance from others minimizes the chances of spreading droplets of this virus. Please don't let up. We need to be resolute, and together we all must maintain our distance to limit the spread of the virus and keep everyone safe. As the numbers of cases continues to grow, it is critical that the 6-foot distance is maintained. There has got to be 100% compliance. I encourage you to reach out and check on your neighbors and to help those in need. But the most important thing we all should be doing is strict adherence to social distancing. We can all potentially carry this virus with little to no symptoms and unknowingly spread it to others in close distance. Maintaining 6 feet from others at all times can prevent transmission of the droplets. And we should maintain distance from others in all situations to ensure that we do not become vectors and spread the COVID-19 virus. This is not the time for parties, play dates, and get-togethers. They are all prohibited in accordance with Executive Order 107. And of course, stay indoors and self-isolate if you are not feeling well or showing symptoms. If we all do our part and exercise social distancing, we can limit the effects of this virus and return to normal life sooner. Flattening the curve is what we are trying to do. We have the opportunity now to reduce the impact of this virus in our community. Flattening the curve will put our first responders and healthcare workers at lesser risk, will relieve the burden on our healthcare system, and will save lives. Prevention through hygiene, social distancing, and quarantine when feeling sick will flatten the curve and get us out of this situation sooner and back to normal. Please help do your part. We are all affected by this pandemic, and we are all making sacrifices for the greater good so we can get back to normal. Our local businesses are so critical to the fabric of our community, and our restaurants, through takeout and delivery, continue to operate through these tough times. Many have stepped up and provided free meals to our first responders, our health service providers, and those in need. Our local grocers are keeping their shelves stocked, and their employees are playing a vital role in keeping our community nourished. Our health service workers and our first responders are on the front lines, leaving their own families at home to care for others and putting themselves in direct harm. Please take time to acknowledge all of their efforts. Your local government continues to function under a state of emergency. The municipal building and other township facilities remain closed to the public, including the library and Rhoda Center. All in-person public meetings and all gatherings in public buildings continue to be suspended. Our workforce continues to serve our community during this difficult time. We have taken measures to minimize the risk to our workforce. In addition to reducing staff, many of our employees complete their work assignments through a remote connection. We adjusted shift schedules to ensure greater flexibility for our employees, many of which are sharing in the care of children now at home or for elderly parents or relatives. Our first responders from the police and fire departments continue to protect our residents and respond to all situations. I am appreciative and thankful for their dedicated and committed service to our residents. The Township's Volunteer Ambulance Corps continues to serve our 41,000 residents, handling 20-plus calls a day. We are extremely fortunate to have such a fine group of dedicated individuals who put their health and well-being on the line every day. In addition to our emergency personnel, I would also like to thank all the workers across the Township that continue to serve our community during these difficult times, such as our postal workers, bank employees, restaurant workers, healthcare workers, pharmacies, trash collectors, and others providing essential services to our community. I encourage all residents to utilize our online services as well as email and telephone communication to conduct business. I am asking landlords to please show compassion at this time and work with your tenants on deferment and payment options. My office continues to post daily updates and links on our COVID-19 emergency page, which can be found by visiting www.teanecknj.gov. You will find resources such as Governor Murphy's executive orders, the Center for Disease Control, the New Jersey Economic Development Authority, the New Jersey COVID-19 webpage, worldwide statistics, information from the Teaneck and Bergen County Health Departments, bills affecting local government, tips from age-friendly Teaneck, mortgage payment relief, food assistance, Bergen County test site locations and hours, rumor control, tax information, and resources for people and pets affected by COVID-19. Please support the local businesses that remain open. A list of restaurants providing takeout and delivery are on our website. I encourage everyone to sign up for Township Alerts. It is easy to do, and you will remain connected to the latest information on the COVID-19 virus. Please visit the Sign Up for Township Alerts tab on our homepage. We will continue to monitor the spread of the coronavirus throughout our region. As manager, I will continue to do everything possible and use all available resources to protect those who are most vulnerable. This will continue to be a difficult and extraordinary situation until the emergency is lifted. In an effort to protect all members of our community and workforce, especially those who present the highest risk for complications of the COVID-19 virus, I made and will continue to make decisions as manager to prevent its spread. My office conducts regular briefings with staff command through teleconference. I remain in daily contact with the mayor and council to provide them with updated information as it comes in. The council continues to supply me with the resources and, more importantly, the support that will help us get us through this crisis. For that, I personally thank them. Communication continues on a regular basis with the Township's OEM coordinator, Teaneck's school superintendent, Dr. Christopher Irving, officials from Holy Name Medical Center, and our partners from Fairleigh Dickinson University, all of whom have provided excellent leadership and decision-making during this crisis. The Township's Health Department has fielded hundreds of calls and emails from residents for guidance and direction. They are working extremely hard to investigate the cases and handle the many inquiries sent to their office. Questions related to the virus can be emailed to covid19@teanecknj.gov. These measures implemented, discussed, and listed on our website are part of a coordinated response to the continued outbreak and to aggressively mitigate the spread of the virus. The decisions our federal, state, county, and local officials made over the past month have impacted everyone. As difficult as they are, I stand by all of them. They serve to safeguard our residents from the spread of COVID-19. I can't stress it enough, these actions will help save lives. There are many moving parts of this virus, and information continues to change daily. While there is still much to learn about COVID-19, residents should remain calm and vigilant in their personal efforts to reduce the spread of the virus and monitor the Township's website for updated information. Let's quickly review a few precautionary measures. Wash your hands frequently with soap and water or with a 60% alcohol solution. Maintain social distancing of at least 6 feet. When someone coughs or sneezes, they spray small liquid droplets from their nose or mouth, which may contain the virus. If you are too close, you can breathe in the droplets, including the COVID-19 virus, if the person coughing has the disease. Avoid touching your eyes, your nose, your mouth to avoid the transfer of the virus. Practice respiratory hygiene. Make sure you and the people around you follow good respiratory hygiene. This means covering your mouth and nose with your bent elbow or tissue when you cough or sneeze. Then dispose of the used tissue immediately. Stay home if you feel sick. If you have a fever, cough, and difficulty breathing, seek medical attention and call in advance. Follow the directions of your physician. Calling in advance will allow your healthcare provider to quickly direct you to the right health facility. This will also protect you and help prevent the spread of the virus and other infections. As Teaneck residents struggle to protect themselves and their families from the COVID-19 virus, there has been widespread use of masks and gloves throughout the township. Unfortunately, this practice has given rise to another unsightly problem: litter in parking lots, shopping carts, and parks. Soiled masks, gloves, and disinfectant wipes are being discarded by people using these facilities. This practice is unsanitary, rude, and selfish. This not only is harmful to our sewer system, but it potentially exposes our residents, workforce, and other private workers who must clean up the litter to exposure of the virus. In closing, I'd like to thank the employees of Teaneck who have remained strong and supportive through this crisis. Day in and day out, they continue to provide essential services to our residents, despite challenging circumstances. To the residents of Teaneck, I will continue to manage and lead this community in a responsible manner. Now is the time to focus on what's important in our lives: your families, our friends, our neighbors, our community. Keep them in mind when making decisions. This crisis demands that each and every one of us do our part to minimize the spread of this disease, to avoid putting the vulnerable and susceptible at risk, and to prevent our healthcare services from becoming overburdened. We are all in this together, so we need to work together. We will get through this together if we remain vigilant, even if it means remaining isolated for long periods of time. We remain Teaneck strong. Thank you.